Wonderful. Hi, all. Good afternoon. My name is Jason Resendez, President and CEO of the National Alliance for Caregiving. And after that intro music, I'm absolutely pumped for this conversation. And it's my pleasure to welcome you to the Champions in Care Forum, a pivotal event focused on shaping the future of transplant care in the U.S. And before we begin, I'd like to extend our heartfelt thanks to our partner, the Global Liver Institute, our speakers from CMS, HRSA, OPTN, Transplant Families, and the Dell Seton Medical Center, and to our sponsors, Takeda and Sanofi, for their generous support in making our work possible. Today, we'll engage policymakers, advocates, providers, and family caregivers in a dialogue on the critical reforms that are transforming the landscape of transplantation in this country. Our discussions will center on two key initiatives: the OPTN Modernization Initiative and the efforts of the Organ Transplantation Affinity Group. As we delve into these important topics, we'll pay special attention to their impact on a group that is often overlooked but absolutely crucial: family caregivers. According to a recent report from the National Alliance for Caregiving, despite their crucial role in the transplant care continuum, family caregivers are generally understudied, under-resourced, and under-supported across the transplant system. Our forum today is designed to engage in dynamic discussions that highlight the essential role of caregivers in transplant care, advocate for policies that prioritize the needs of these unsung heroes, and to equip you with the insights needed to drive policy and practice change to improve transplant care outcomes for both patients and their dedicated caregivers. By the end of our session, we aim to leave you not just informed, but inspired and prepared to champion the cause of family caregivers in transplant care. Your participation today is vital in our collective effort to improve the transplant care system. Together, we can ensure that the voices of family caregivers are heard and that their needs are met. So thank you for your partnership, your interest, and all the work that you're doing and will do to uplift family caregivers in transplant care. Now I'll turn it over to my colleague, Yadira Montoya, NAC's Director of Programs.
Thank you, Jason. So, for my presentation, I'll be sharing more information about the NAC report that Jason mentioned, which we released last fall. Transplant caregivers face similar challenges as other caregivers, but with added complexities due to the intensive nature of the transplant process. In fact, most patients must identify a caregiver to be waitlisted for either solid or not solid organ transplants. That means that, as Jason mentioned, caregivers are essential for receiving these life-saving procedures. However, while the system acknowledges the need for caregivers, it inconsistently provides education, training, and support for them to fill this role. The findings of our report point to a strong need to establish awareness about the gaps in support for transplant caregivers among health system leaders, policymakers, and the patient advocacy community. Our report included data from a literature review, a subject matter expert panel in transplant care, focus groups with 30 transplant caregivers, and we also conducted oral histories with about a dozen caregivers about their everyday lives at serving as a caregiver. Here are some key insights from our report. One, we have limited knowledge about the experiences and needs of transplant caregivers. This knowledge gap is even bigger for caregivers of racially, ethnically diverse, culturally diverse, and linguistically diverse backgrounds. Our report revealed that caregivers often receive what's available in terms of support. Many reported receiving supports, reported limited supports, unless they actively advocated for themselves or if the unmet caregiver need impacted patient outcomes. Transplant caregivers are also being asked to help with medical and nursing tasks, typically in the past provided by healthcare professionals. These things include changing bandages, administering IV drips, dressing wounds, dispensing medications, and monitoring vitals. Therefore, it is critical that they receive early and repeated education and training. This slide shows the gaps and inequalities and burdens placed on families posed by the current transplant system, as well as the lack of systemic support. In the interest of time, I won't go over all of these 6 major themes that we found in our report, but encourage you to visit our report, and I'll just give you the top lines. Transplant caregivers reported challenges accessing and navigating the transplant care system, especially during the waitlist process. They found the waitlist rules really confusing and frustrating. And caregivers of Medicaid beneficiaries also reported receiving lower quality of care and additional challenges in accessing what their care recipient needed. Transplant caregivers also told us about the significant financial burdens they face due to frequent appointments, travel costs, and potential overnight stays near the hospitals where they would receive the transplantation or follow-up care. Many caregivers reported challenges maintaining their employment and also experiencing income loss. Mental health struggles were also a significant concern. Research aligns with this, showing that transplant caregivers experience increased stress and depression compared to pre-transplant levels, and that they may also experience the same level of psychological distress as the patient or even higher. We developed the following recommendations to ensure that transplant caregivers are provided with the necessary and deserved support, services, and resources. First, a standardized screening process and caregiver identification. The lack of standardized criteria necessary for transplant leads to many inequalities. A standardized process would delineate the necessary caregiver requirements that are applied across all transplant centers. Further, caregiver identification during the screening process would help determine who is meeting the criteria as a caregiver, who is being turned away, and why. Second, caregiver-specific data sharing and coordination among transplant centers. Transplant centers should standardize their process for data sharing and coordination. This would really aid caregivers and patients in their care coordination and save time and stress for caregivers and patients, especially during the waitlist phase. Third, a coordinator or a dedicated member of the transplant team who can serve as the caregiver's go-to person. Often the caregivers would tell us that they received information, but they didn't necessarily receiving information about how they could fulfill their role, or were being asked about what their needs were to support the transplant recipient. So having a dedicated person would really help with that. Fourth, routine screening to help identify the needs of the transplant caregiver and connect them with resources. Again, as I mentioned in an earlier slide, often those caregivers who received support were those that were actively advocating for themselves or when something went wrong. And then the healthcare team would step in and try to investigate what was happening. It was a very common scenario. Fifth, policies and practices that provide financial assistance, workplace protection, and ensure adequate medical coverage for the transplant caregiver to help alleviate financial burdens and not jeopardize their current or future financial situation. But these are the 5 recommendations that we issued last fall. I am really curious about how they resonate with the audience and which ones are you seeing in your transplant community. So I would love to see if there's, we could have some action some activity in the chat. If there's any of these recommendations that really resonate with your personal or professional experience or those communities that you represent. And while we do that, I will transition into the next item in our agenda. So, thank you. Okay. So now it is my pleasure to introduce Jean Moody Williams and Dr. Suma Nair. Jean Moody Williams is the Deputy Director for the Center for Clinical Standards and Quality at CMS. She is responsible for leading quality improvement, value-based purchasing, delivery system reform, and kidney health activities. She is also responsible for the execution of inspections for thousands of the nation's healthcare providers to ensure compliance with health and safety requirements for over 90 million people. Dr. Suma Nair is the Associate Administrator, for the Health Systems Bureau in HRSA. She leads a portfolio of unique programs to improve access to care and strengthen public health and healthcare systems by increasing access to organ and blood stem cell donation and transplantation, including the efforts to modernize the organ procurement and transplantation network, which I will refer to as OPTN moving forward. Jean and Dr. Nair will be setting the stage for a conversation with the panelists. They will be sharing updates from HRSA and CMS's efforts related to the OPTN Modernization Initiative. So I hand it over to both of you.
Thank you so much, Adira. I think I'll start off the conversation and really found your findings from the study quite interesting, probably not surprising. And this is just a great forum that we're having here today. So thank you for the invite. If we could put up the slides, please, we'll quickly kind of run through some of the details, but I'm really looking forward to hearing from the caregivers. So I'll be fast and efficient here. If we could go to the next slide. Really, CMS, I know a lot of times when we talk about a government agency, it's, you get visions of this big building, but there are actually people in that building, and we are well aware of the urgency of improving the system. And the statistics, you know them well. I'm not going to go through them, but they continue to be startling as we think about the need in the country. And we really want to foster collaboration and shared accountability across the care spectrum. And that includes working, too many times we just work with one sector here, one sector there, but we really want to work with the entire system. That includes nephrologists, the dialysis facilities, transplant centers, primary care, and other specialists. But most importantly, working with the patients and the families and the caregivers, starting with the time of the first consideration of transplantation, and then all the way through to actually receipt and care, receipt of the organ and care of the patient and the families and the caregivers after. So we especially thank you for all that you're doing to work toward the shared goal of improving the system. On the next slide, we knew early on that really seriously tackling the challenges of the transplantation ecosystem is larger than the work of any one agency. And so recognizing that need to ensure coordination across the agencies, and I think there are more than 14 within HHS, Secretary Becerra established a coordinated effort to improve organ donation, procurement, and transplantation. And so to that point, we formed an agency-wide and interagency-wide collaborative group with our partners at HRSA, and you'll hear from Dr. Nair shortly, known as the Organ Transplantation Affinity Group, or OTAG. And within OTAG, we want to ensure a strategic and comprehensive approach to overall system improvement. It's led by the Centers for Medicare and Medicaid Services, CMS, and HRSA, and it seeks to really drive those improvements that I was discussing. And I'll let you know that there are many times people say, well, who's on the OTAG? There are more than 30 staff at CMS and HRSA. We meet at least monthly. And many times more than that. We're during the week, we're always in discussion. And we report up through our various administrators, and then we report up to the secretary. Now, although we are a federal group, we are continually seeking input from all interested parties. So your input is really essential to establishing and achieving our goals. On the next slide, you'll simply see here that we have if we could go back one, I'm sorry. Yes, that one. So you'll see here our mission, our vision, and our purpose as we work toward really knowing and recognizing the importance of a transformed organ donation and transplantation system. Okay, now I just wanted to point out that we are mission and vision driven here. On the next slide, now what we did, most important to our work is listening. Now that's the first thing. And so we did what we call a journey map, where we talk to patients, we talk to families, caregivers, physicians, all the people I mentioned earlier, to what were those things, where were those areas where improvement was most needed? And these line up fairly nicely with many of the things that Yadira talked about in the study that was presented just a minute ago. The data that was needed before a referral process, partner and education so that you could make good decisions. Once a referral is made, knowing where there's variation, why are some people referred and some not, what makes a good candidate, what doesn't. And then the evaluation, there wasn't as much transparency as was requested with the criteria that are even used. And then the wait list, who goes on the wait list? Who comes off the wait list? How long do you stay on the wait list? And during procurement, always making sure that organ procurement organizations are continuously improving. They're very good organizations that exist, but I think we all know the need for improvement. And then the actual transplant, we know that there are organs that could potentially be used that are often unutilized, or challenges with payment. That was one of the things that came up, and being from CMS, that particularly resonates with me. And then on the next slide, we also heard about, and we know about, the disparities that occur. And access to organ transplantations varies not only by geography, but also factors by race and ethnicity, disability status, and socioeconomic status. And so we are very committed to addressing those concerns and advancing equity in organ donation and transplantation so that everyone has a fair and just opportunity to attain optimal health. And on the next slide, so we've already started working. We've been working for a while, and we identified some high-level areas and a few detailed areas that Suma will go into shortly, where we have begun to align, such as improving our alignment, making sure that CMS knows what HRSA is doing and HRSA knows what CMS is doing, so we don't send mixed messages, so that caregivers and families kind of better understand the system and the providers as well. And then harmonizing the data. We want to be able to give you information that is that's understandable and that's not conflicting. So we're looking at our information there. And also are looking to see the complaint process. We heard, well, it's not always clear if we do have a complaint. Who do we send it to? So we've established some processes. We'll be releasing that very shortly, where there's no wrong door. If you come to HRSA, they'll make sure we know about it, and vice versa, or we'll make sure whatever agency needs to know about it knows about it. And so those processes are in place right now. So we'll continue to identify, but I'm going to turn now to Suma to give a little bit more detail on some of the things that we're working on. Suma.
Great, thank you, Jane. Let's jump to the next slide. And so encourage you on, we'll stay on this slide, but 2 slides ago, there was a URL. So that links to our blog where you can find out more information about OTAG and the work we're doing together. And so I encourage you there. But to guide or kind of support us getting in action together across HRSA and CMS, we laid out this action plan. So I just want to orient you to it and then encourage you to take a deep dive as you have time. So guiding our work together are the 2 aims. One, increasing or improving the U.S. organ transplant system performance and improving the system's equity. And we're really focused in those 2 areas by working on addressing these 5 goals that we've laid out here. So all of our activities and things will align with that. We want to, 1, reduce variation in pre-transplant and referral practices. Again, resonates to some of the data that Yadira presented at the top. We want to increase availability and use of donated organs. We want to increase accountability for procurement and matching. We want to promote equitable access to transplant. And we want to empower patients, families, and caregivers to actively participate in the transplant journey. So that's a bit about our kind of aims and goals there, and an opportunity, again, as Jean has said, I think it resonates with how we're working individually in CMS and HRSA and collaboratively in OTAG. We've put this out, we're doing a lot of listening, and we're welcoming folks to kind of share their thoughts about the action plan, the aims, and the goals. So let's jump to the next slide and shift gears a little bit, and I would love to share a little bit with you all about what we're doing in our efforts around OPTN modernization to support the shared OTAG aims and goals that I just discussed. So I just want to take a moment to ground everyone in what is the Organ Procurement and Transplantation Network. It was established by Congress in 1984, really to ensure that the precious gift of life, that these donated organs are allocated equitably to individuals in need in a safe and effective manner. And so HRSA is the primary federal agency that has oversight over the entire system, the OPTN system, and all of the members. We work collaboratively with the OPTN Board of Directors and all of the members to achieve the 4 goals that you see, right? Increasing access to transplant, the safety of transplant, and procurement. We can go ahead and jump to the next slide. This slide just gives you a little kind of visual representation about the key roles of the government, of the OPTN board, and the OPTN members. And this will give you a sense as you're thinking about how to engage and support and raise forward some of your interest in this area of caregiving support, how each of the roles and members work together to really support this unique public-private partnership that is the OPTN. So HRSA has oversight responsibilities to make sure that the way the OPTN is working is consistent with the law. The board is very focused on organ allocation policy development of membership standards. So for each of the OPTN members, the hospitals, the organ procurement organizations, the histocompatibility labs, that they're all complying with those standards developed by the board, and also monitoring for compliance with the standards and policies. So the key point here is it takes this strong partnership and collaboration between HRSA, the board, and all of the members of the OPTN to help us take the system we have today and strengthen it and shore it up to have even better results for patients and families. Let's go ahead and jump to the next slide. So for the past several years, you may be aware of some of the efforts to examine the OPTN and the transplant system at large and really look for opportunities to further improve and strengthen this essential system. Congress, researchers, physicians, surgeons, the National Academy of Science, Engineering, and Medicine, and many more have all identified opportunities. Patients and families have identified opportunities to strengthen the system. And so in March of 2023, HRSA really took all of that feedback and put forth our vision for how to modernize the organ procurement and transplantation system to better serve patients and families by improving equity, accountability, and transparency of the system. So let's jump to the next slide. So I want to take a moment, and this will resonate with some of the comments that Yadira shared, the notes from the study at the top here. As a part of our process, as also you heard with Jean, the first thing we do kind of from the federal side is really listen to the stakeholders and understand what are the areas that are ripe for improvement and areas that we should retain and areas that we need to really improve upon. And so when we started our effort around OPTN modernization, it was done with robust engagement from the transplant community, including patients and families. We spoke to over 800 individuals and groups, more than half of which were with patients and families. And this slide shows some of the topical areas raised by patients and families regarding opportunities they saw to improve the system. And so I'm not going to, in the interest of time, read all of them, but the top line, I think, is there was real concern about the opaqueness of the system, and that really to a person, the sentiment from patients and families were They believe that better transparency in the various practices and processes within the transplant system, whether it's waitlisting, referral, organ offers, is really essential. So that transparency coupled with better education and support, whether it's behavioral health support, healthcare system navigation support, financial support, those two taken together, that transparency and support would really empower patients and families and caregivers to manage their journey throughout the entire transplant process. And so those are some of the key things that we're considering as we move forward and take this opportunity to really interrogate the system and processes that underpin the OPTN and see how we can strengthen them moving forward so they're more agile, they're more patient-centric, and they help us make sure that we're leveraging kind of the most best expertise, kind of innovative thinking to really make some of the improvements that we want to see in the system. And so I'll jump to the next slide and give you a little bit more about our OPTN Modernization Initiative. So we launched it in March of 2023 with a focus on 5 kind of core processes or areas: technology, data analytics, governance, operations, and innovation. The Modernization Initiative is really centered on putting patients first, prioritizing information flow, right, data and technology, to clinicians, then to the care team, and then to patients and families to make the best decisions. Really to promote innovation, and then enhance transparency and accountability. To that point, we share regular updates. In the interest of time, I won't go into all of the accomplishments and things that we've done over the last year and a bit, year and a half here. But I encourage you to check out our website. If you go to the OPTN Modernization website off of the HRSA.gov, HRSA.gov website, you can see we post regular updates on each of our efforts around modernization, so you can keep kind of track of where we're going. I also will just conclude by encouraging you to participate in this effort. As we move forward to design the system, we're doing it in a very user and community-centric way, where we're understanding from you what are the pain points and what are the opportunities to strengthen this. So please make sure the unique concerns of caregivers, patients, and families really help shape the path forward in our modernized system so that we can better meet the needs of patients and have better outcomes across the system. So invite your participation there. And with that, I turn it back to Jean to provide one last update.
Thanks. Next slide, please. Just wanted to close out to note, because payments come up a couple of times, that CMS will pay for certain types of caregiver education when it is provided part of a medically necessary face-to-face visit. And Medicare may pay in general for certain caregiver services, I'll call them, but they're really support and family, the work that you do. But some Medicare Advantages and Medicaid plans also offer family caregiver reimbursement for the hours provided at home. Importantly, we recognize that the first 2 bullets I said aren't enough. So for 2025, we have proposed that we will have new payments for caregiver training services related to direct care, and that they wouldn't necessarily have to be face-to-face, and they would be more geared toward the specific needs. So that rule that is proposed, we will be finalizing it in the fall, and based on comments, we'll see where that goes. We also host quarterly caregiver work groups, and the next one is coming up October the 2nd, and I've given you where you can register. So with that, I think that ends our presentation, and we'll turn it back over. Thank you.
Thank you, Jean and Dr. Nair, for providing such a helpful overview of the current transplant reform efforts, as well as updates. 2 of the main takeaway from your presentations for me are, the collaborative effort that's needed to truly address the challenges faced by transplant patients and caregivers. And I know that NAC will definitely take you up on your offer, and HRSA's offer, to provide more input on the reform on these efforts as they relate to caregivers, because we believe deeply that it's one of the groups that is directly interacting with and being impacted by the transplant care system, and not necessarily always being centered. So thank you so much for that. So we're gonna shift gears a little bit, and we're gonna turn it over to our amazing panel of amazing panelists. advocates who are working to find ways to improve the transplant system for patients, caregivers, and families. And before we get the conversation started, I'll introduce everyone. So Cody Reynolds is a caregiver to his 5-year-old daughter, Elena. Elena received a liver transplant in 2021. Cody and his wife, Kelly, provided around-the-clock care, including performing medical tasks like NG tube feeds, IV antibiotics, and TPA lipids before her transplant. Cody currently serves as the UNO's Region 4 representative on the Patient Affairs Committee. He's a board member of the Transplant Recipients International Organization, or TRIO, of Oklahoma, and the Care Network Advisory Committee. Cody and his family reside in Oklahoma and are citizens of the Chickasaw Nation. Gina Bartz oversees the patient and community engagement aspects for Global Liver Institute. In this role, she leads GLI's liver health education, advocacy training, development, and creative programming across the globe with stakeholders at every level. Gina advocates for patients, caregivers, and joins a network of colleagues and liver champions across the globe from many academic centers, liver clinics, and organizations working to eliminate the stigma and promoting access and normalization of liver health equity and inclusion. Lorinda Gray Davis is a dedicated advocate for transplant recipients with a personal and professional commitment to the transplant community. She is the vice chair of the Patients Affairs Committee and a member of the Policy Oversight Committee for OPTN. Her advocacy is rooted in her own experience as a liver transplant recipient, having overcome end-stage liver disease and inoperable liver cancer. She continues to support others through her work as the president of TRIO. And next we have Melissa McQueen, who co-founded Transplant Families. After her young son received a heart transplant, Melissa found herself searching for support that was devoted solely to pediatric transplant families. Melissa is involved in the pediatric transplantation field and is on the board of directors for UNO's /OPTN, and formerly served as on the Data Advisory Committee, Pediatric Committee, and on the subcommittee of Patient Affairs. And last but not least, we have Gloria Chen, who is a practicing kidney transplant social worker for the Abdominal Transplant Center at the Del Seaton Medical Center at the University of Texas at Austin. She has worked with transplant patients, donors, families, and caregivers in kidney transplant for over 13 years. She is a member of the Society for Transplant Social Workers, the American Society of Transplantation Psychosocial and Ethics Community of Practice, and the OPTN Ethics Community. Wow, I'm really excited to chat with you all and hear more about your work and your different perspectives. And so to ground the conversation, the first question is going to be for you, Cody. Can you share a little more about your transplant caregiving story and the challenges that you faced post-transplant, as well as the coordination between the transplant center and the Indian Health Services?
Sure. That's a great question, Yadira, and I think it's one that many will probably relate to. Our transplant caregiving story began well before we even got to transplant. My wife and I were caring for Elena, who was just a newborn. You know, we were doing kind of things that normal parents do, changing diapers, making bottles, but we were also spending long nights just waiting for a feeding pump to go off so we can get a few hours of sleep. We were preparing those late night antibiotics, cleaning her PICC line, waiting for those to finish. And many times we would be in the hospital just trying to catch a nap or grab a bite to eat in between the baby sleeping. Some of the challenges that we faced once we were on the post-transplant side of things were coming up with the routine to give medications, tracking when our next clinic appointment's going to be, when our next lab appointment was. And in my opinion, the most difficult challenge of that was adjusting to life in a new city while we were in Houston. Being out of work was another challenge that we were adjusting to. Fortunately, we had kind of stored up a bunch of leave that we were able to use, but that only lasted a few weeks. In terms of working with Indian Health Services, we have been very blessed between the coordination with our transplant center in Houston, our transplant center in Oklahoma City, and also our primary care provider with Indian Health Services. They have all worked hand in hand to communicate with each other. They've communicated great with us, letting us know when referrals are due, if there's anything that IHS needs to take care of with our primary care provider. Again, they have been great following up with those appointments and referrals, so that most of the time we're not out of pocket anything other than kind of just a standard copay.
Gotcha. Thank you so much for sharing that, Cody, and really highlighting not only the work that it takes to coordinate and to navigate the system, but also doing that as well as having work, life, and other responsibilities, and just the juggling act that transplant caregivers have to do for that. So with that, I'm going to turn, Gina, let's turn it over to you. And I would love to hear a little bit more about GLI and its advocacy effort as it relates to the OPTN Modernization Initiative, specifically about how you all are working to advance health equity in transplant care.
Thanks, Yadira, and hi, everyone. Gina Bartas from Global Liver Institute. I'm also a patient and a caregiver, and so I am very happy to be here and honored to answer the question. As many of you know, our founder, Donna Cryer, is a rare disease patient and a transplant survivor of 30 years, almost 30 years, and has been involved in OPTN reform. Ultimately, GLI supports transparency and shared accountability in the governance of organ procurement and allocation. I think all patient and caregiver communities will be best served when shared accountability and transparency are the focus. And that is definitely where GLI is coming from.
Great, thank you for that. It's clear that GLI has a long history of advocating for transplant patients. We recently partnered on a comment letter around the IOTA model, and so it's been great to work with you and GLI on this effort. Anything else that you want to share about GLI's current work in this space in terms of
Absolutely. So I think coming up, and most importantly, we have a year-round model of advocacy training for patients and caregivers that are specific to the community. We call it our Advanced Advocacy Academy, and the Advanced Advocacy Academy is focused on training caregivers and patients at any level, entry level, especially in the basics of advocacy and what it means, how to speak to your policymakers, how to make changes, how to make a difference in something that's important to you or something that's affected your life. So if you're interested in learning more, please feel free to reach out. Yadira knows how to get a hold of me, but we welcome all of our patients and caregivers to be involved. We have a virtual component, and then once a year have an in-person component in Washington, D.C. And that's a really good way to understand how you can craft your story and package your story in a way that is meaningful and impactful to your legislators and policymakers, and how to understand policy and legislation and how it impacts your healthcare and your loved ones' healthcare.
That sounds like a really great program, Gina, and you can drop it in share the link in the chat, and we're happy to follow up and
Thank you,
share with attendees as well. So, Lorinda,
Thank you.
before I jump into my question, can you briefly tell us about how TRIO works to benefit transplant caregivers and their families?
Well, pardon me. So thank you very much for having us here today. I really appreciate it. And just my sincere gratitude to the National Alliance for Caregiving and Global Liver Institute for putting this together. And we work, TRIO, Transplant Recipients International Organization, works diligently to connect pre and post-transplant patients, and that education piece that always seems to be missing because patients do not know about transplant until they're told they're in end-stage liver disease, and that's when the entire family finds out about it, and it's a complete shock to patients. And so with my work as on the Patient Affairs Committee with the OPTN Patient Affairs, you know, the committee serves between patients, caregivers, and the broader transplant community. You know, we try to ensure that voices are not just heard, but a part of the policymaking process. And one of our key initiatives right now is we're advocating for is a patient awareness listing status, which is called PALS program. And that program is designed to increase transparency and awareness, patient empowerment for them to help patients understand their waitlist status and organ availability. And as caregivers, this is especially important because when they're in the doctor's office, it's hard to catch everything a doctor is actually telling you. And so engaging patients and caregivers in policy conversations is extremely important. And as caregiving patients, we bring unique perspectives with lived experiences. And when discussing reforms to the transplant systems, it's not just about logistics. It's about understanding the human impact of the decisions, and something that only those who have walked that path can truly articulate. And, you know, we have a long way to go. The transplant system is complex. And while we've made significant strides, our voices need to be heard and be louder and unified. And so I just want to throw in that public comment is here. And so for me, I'll read something and I'm like, darn, I did not know about it. This is something that I really need to do. So it's open until September 24th, and it's critically important. And it's an opportunity for us all to make sure our voices are heard, to ensure that policies being shaped reflect our needs, our concerns, and our hopes for the future. And I urge everyone listening today to engage in that process, because real change happens when we all stand together.
Yeah, thank you for that that overview of TRIO, and also the opportunities to engage and the importance of engaging and taking action. And so we'll have some action at the end of the a slide around some actions that folks can take as it relates to this topic. But I also, similar to Gina, if there is a link that you want to share, please do so in the chat, or we can follow up, send it as a follow-up to folks. So thank you for that.
Thank you.
Now it's time to hear from Melissa. So Melissa, in your bio, you included a bit of a history of why you started Transplant Families. And I would like to hear more about what your work looks like now, and then any specific needs and considerations for pediatric patients and their caregivers.
Absolutely. I guess the one thing that's changed from my bio is I'm a former OPTN board member now, but so proud to have served and glad to be here today. Thank you to NAC and GLI for holding this very informative webinar, and thanks to everyone on board. I'm just so honored to be here with this group. I am the caregiver of 3 fantastic children. My youngest is 16. He received his gift of life, a new heart, at 8 months old, and that's what brought us into this journey. I can definitely identify with many of Cody's remarks. So we spent many a night changing feeding pumps and going daily to the hospital. We also traveled for care. It was a huge burden on our family. And the more I met other parents like Cody, the more I realized this was a real need. And so I'm glad that the NAC is here to be able to address those needs. Children are a vulnerable group and must be prioritized in the new system going forward. Within the new framework, we have to emphasize pediatric specific criteria and considerations. Our current structure has proven quality should count as much as quantity when transplants happened. And we've seen a segment of transplantees that between careful policymaking and their youth and physiological resilience have the ability to live a much longer life with their gift than sometimes their adult counterparts. We hope that this anomaly will be studied and acted on and within learning networks, and so that we can keep this trend up for children and expand these benefits to adults too. I mean, in 2 years, my son will be 18, and I want him to have an equally robust adult system as he has seen in this amazing pediatric system that we've had. Advocating for the policies that prevent disparities and ensure equitable access to transplants for children, it takes money, perseverance, and insurmountable strength as a family can get from end-stage organ failure for child to a life-saving transplant. We as caregivers know that the sheer cost of transplant can destroy a family, much less the expense of traveling to a center that is able to support a transplant program. These are highly specialized units, not always geographically available across the country. So that's something we'd also like to see expanded in this new modernization effort.
Yeah.
So those are a couple of the, yes, thank you so much. I appreciate it. So many more, but just glad to be here with you.
Yeah, thank you. Your personal story is really inspiring, as that many of the previous speakers, but also, you know, the through lines that you see in terms of their the transportation, the need for information, the need to really engage and hear from those directly impacted. So thank you for all the work that you do as an advocate. So now I'm going to turn it over to you, Gloria. Can you tell us a little bit more about your work as a transplant social worker? And what are the kinds of training and support that healthcare providers need to effectively incorporate caregivers and their needs into the transplant process? So not an easy question, but one that I'm sure you'll have a lot of insight into.
Thank you, Yadira, for the question, and then also to the organizers for inviting us to be a part of this panel discussion. I've been a practicing transplant social worker for some time now, and I got into the field of transplant and fell in love with it, namely because of the opportunity that we have as transplant professionals to have such long continuity of care with our patients from before their transplant to following them after their transplant and seeing the deep transformative impact that transplant has on them and their families. The clinical work that I do includes evaluating and assessing potential transplant candidates to determine if they have caregiver support, along with other psychosocial considerations. I also conduct research on psychosocial concerns in transplant, such as barriers to transplant access. And I think the first thing that healthcare providers need is a better understanding of the impact of caregivers. As we all know, caregivers are such an integral part of the transplant process. And as shared by all of the members on this panel, we know that caregiver support has immense benefits for recipients, including helping them get through the whole transplant evaluation process, which is long and arduous, supporting them through their transplant surgery and hospitalization, and providing that much needed emotional, tangible assist during their post-transplant recovery. While all of us may know the value of caregivers experientially, there is still comparatively very limited research on the impact of transplant caregivers. I was really happy to hear about the research that the National Alliance for Caregiving conducted last year on transplant caregivers and their needs, which is a much needed step towards the research that needs to be conducted. I think more robust research to help understand the impact of caregiver support on transplant outcomes, as well as the ways that transplant providers evaluate for and intervene to mobilize caregivers and improve support for patients. Greater research can help healthcare providers better understand the value and incorporate caregiver needs throughout the whole transplant process, while also helping to ensure that caregiver needs are met and that inequities are not further propagated within transplant.
Mm-hmm. Thank you so much for sharing about what you do and also this key piece of the needed I guess the gap in information that we have about the transplant caregivers, their experiences, their needs, and if we delve a little bit deeper, what do those look like across geography, across race, ethnicity, socioeconomic status, et cetera. Yeah, thank you for that. Now that we've heard a little bit about your personal and professional experiences and connections to this topic and what you bring to this work, I'm going to jump into our second round of questions, and I have the same question for everyone, and it is, from your perspective, what additional transplant reforms or policies are needed to better recognize, support, and train family caregivers in transplant care? I know that some of you already began to answer this, and so if you have anything to add, please do so. And we're going to follow the same order that we did the first round. So let's start with you, Cody, and I'll repeat the question. Let me know if you need me to repeat the question once we get down the line of panelists.
No, Yadira, you're good. I have the question here. So caring for someone doesn't just end when they have their transplant, right? I think everyone on the webinar would agree today. I think, in my opinion, the most important needs and wants that I have is to feel empowered, to feel like there's other people that look like me, that are like me, that are going through the same struggles and challenges and can relate to what we've experienced. So yeah, I think empowered and to feel supported in the transplant and caregiver community would be my answer.
Thank you for that. And the importance to be recognized and seen for the work that you're doing, being an integral part of the healthcare team is what I'm hearing, and something that NAC has keyed into as well. Okay, what about you, Gina?
Thank you, Yadira. I think it's extremely important to look at the overall equity measures and gaps in access to care, and to take a close look at resources and access and barriers to entry into the transplant ecosystem, and also to pay special attention to post-transplant gaps for patients, and very importantly, caregivers. And I echo what our speakers have said, that collaboration is key to this and will be key to the future. Thank you.
Yeah, I didn't delve into this in our report, but we did have a piece around post-transplant care. And how it came out was that about after the 1 year mark, caregivers really felt like there was a decline in support, in updates and information. And we have a fantastic care partner to his wife who mentioned the challenges during COVID and the lack of information that he was receiving because they're well beyond that 1 year mark. And so I think that's really critical. Okay, I'm going to turn it over to you, Lorinda. From your perspective, what additional transplant reforms or policies are better needed to recognize and support family caregivers in transplant care?
So putting on my trio hat as a patient, and I'm a liver recipient, and my brother just had the liver transplant May 27th. So, I believe a comprehensive training program for caregivers in regards to, we hear about donors and we hear about recipients, but we never hear about the caregivers or the journey that they take. And I believe telling those stories is going to help someone else that's just coming into it, because no one knows about transplant or what's going to be involved with it until they're actually in it. Mm-hmm. And personally, when I ended up with inoperable liver cancer and end-stage liver disease, we had no clue about hepatic encephalopathy, and the toll that it took on my family was just so much. So that falls into the next one, which is mental health support. I believe that we need access to counseling, access to peer groups. We have a peer-to-peer group for care partners is what we call them. And that's twice a month for them, just to be able to come in and learn some different avenues of how other people have handled, the patient itself. And it also matters in regards to what organ is actually being transplanted, because care is different for the organ type. Some need more care than others. And so by implementing reforms and providing continue to support, for critical resources, like the Scientific Registry for Transplant Recipients, SRTR, we can make a significant impact. And I personally rely on SRTR's website to educate transplant families and pre-transplant candidates, because this helps with transparency and ensures that both caregivers and patients understand what lies ahead. And it's essential that we continue to back these invaluable resources to truly support those involved in the transplant journey.
Right. Yeah, the comprehensive training and education really resonates with a lot of the information that we heard, from the caregivers and our expert panel, and that caregiver education and training happens early, that it's repeated, and that it is both about the medical condition, the type of transplantation, about adverse condition at risk and medication, but it is also about how do you take care of yourself as a caregiver and be able to look after yourself so that you can play this role for the transplant recipient. So thank you.
Definitely a PSA for a patient or for caregivers would be wonderful.
Yeah, that one's great. Okay. Melissa, want to hear from you next.
Absolutely. In our subset of pediatric transplant, I'm incredibly proud to say that the patient voice is always included, whether it be research, learning networks, or policy. Our pediatricians have fully embraced the model of patient and family-centered care, which is incredibly important in caregiving. We have to continue to empower this model, and healthcare systems, leaders, and patient advocacy organizations can really utilize this. Our system is fractured, yes, but we must do better by our teens and adults too, so that this village, our transplant community that helps raise these miracle children, are composed not only of their family when they're younger, but also friends and future spouses one day and their own children. This doesn't even touch transfer of care. There are great opportunities here. We lose nearly 20% in the 15 to 25 age range. And I think this is easy. This is one that we could fix. These are just one example of many different projects that could be helped in policy. Enhancing patient and family understanding of disease and post-transplant care to improve adherence and outcomes. Patient education has got to stop being an afterthought. It needs to be embedded and accounted for in every step of the transplant process. And I want to applaud Jean earlier for saying that this was definitely going to be supported on a larger level of the government. So I'm looking forward to it.
Yeah, no, thank you. Your remarks remind me of one of the caregivers that we interviewed for a project talked precisely about the journey of being of taking care of her son who received a transplant, and then the transition between being considered dropping off from the pediatric care team and into adulthood, and the challenge that it became in terms of the team, in terms of health insurance coverage, as well as just other things that naturally happen at the time point. So thank you for being such a big advocate and really highlighting the pieces that are unique to pediatric transplantation and caregivers.
Certainly. Thank you, Yadira.
Wow. Okay. Gloria, would love to hear your thoughts on this question about what else is needed, what specific policies and practices do we need to really address the needs of transplant recipients and caregivers?
I think how we approach caregiving within transplant can be more critically examined and offered more innovative solutions to help transplant patients and their caregivers. And I know that Jean Moody Williams shared earlier that certain patients with Medicare and Medicaid have access to paid caregiver support. But if we were able to expand and offer paid caregiver support to all patients, regardless of insurance, and have a national, not just state, but national policy paying family caregivers for the time that they have to take off from work to help care for their loved ones, would really extend the capacity for caregivers. and reduce that financial strain that family caregivers often face when having to take off time from work to help care for their loved ones. And I think perhaps equally impactful, offering paid caregiver support to all patients, regardless of insurance status, so that patients who either have limited or no caregiver support can also still access and benefit from transplant. I'm also appreciating what I'm seeing in the chat with a few participants sharing about caregiver support groups and mentorship programs. I know that Lorinda Trio looks like is starting a support group as well. At my current transplant program, we're about to launch a mentorship program for not just patients, but also caregivers, because we've recognized that transplant doesn't just happen to patients, they happen to families and their loved ones. And having a peer to journey with you through that process offers valuable support that healthcare providers may not always be able to provide to family members, but peers are able and valuable for caregivers.
Right. Thank you for that. And you touched on the holistic kind of different policies and supports that family caregivers need. NAC is a big proponent and supporter of paid family leave, precisely for the reasons that you outlined, that families are happy to do this work and take on this responsibility. But what we really need is support to be able to do so, to provide the care. And then the peer support programs, and it touches on what Cody mentioned before in terms of as you're going through this process, like really wanting to talk to someone who has been or is in your shoes and how critical that is. And so thank you for sharing that piece. I have been pretty diligent about timekeeping and have gone ahead of our schedule. And so I would love to we have a few minutes before we go on into the Q&A session to open it up for any of the panelists. If there's anything else that you want to share or react to what someone else said, we definitely have a few minutes to engage in that conversation. Go for it, Lorinda.
You know, I just wanted to echo what's been said, because when I started the peer-to-peer program for TRIO, it was after my transplant. So 4 years ago, I'm sitting in my office going, what can I do to help someone that's been through it, that is getting ready to go through it, that doesn't understand the process? And what we found in a group setting, that the pre-transplant and the post-transplant patients help each other through experience. You know, this is my experience. So we actually took that model and we put it into the caregiver. And I like to call them care partners, because I'm a horrible patient. I am one that wants all the care. So when you say care partner, in my mind, I'm like, now I've got to participate. And anything to make it easier for the care partners, I think, is invaluable. And, you know, we have put out data, and we have a couple of papers being published right now over what we've done, because we need to show the data to centers so they will take that into account and help further our needs in our actions.
For sure. Thank you for saying that. Yeah. Anyone else? If not, I'm happy to jump into the Q&A. We received quite a few questions as folks were registering for the event. I see no takers, so I'm going to keep us moving. Okay. So again, thank you for sharing your experiences, your insight, and your work, and all of the exciting updates that are happening. I am going to move us to the Q&A, and for the audience, please, if you have a question, and I see that there's some that have come in, please put it in the Q&A box. And to get us started, I'm gonna start with the questions that we received during registration. So I'm seeing if you can pull everyone up, and these are questions for any of the speakers or any of the panelists. So the first question is for either you, Dr. Nair, or Jean, and it is: does the OPTN scope include living related donation? And can you speak about the policies regarding support for living related donors as caregivers?
Yeah, I'm happy to take that. Thank you for the question. For whoever asked that question, I encourage you to go to or just do a quick search on your favorite web browser of OPTN Living Donor, and it'll bring you up the page with information on the OPTN policies connected to living donation. There's a few. It'll connect you to the Living Donation Committee, the Living Donor Committee, and some of their meeting minutes and kind of what they're focused on. So there's some great information there. So yes, living organ donation does fall within the purview of the OPTN. And to your second part of the question, I would say it's not only the OPTN policy making work that's really important to support living donation, it's also the data collection work connected with the SRTR to have that data registry to track the outcomes of individuals who are living donors, to look longitudinally at the impacts and help us improve the system and care as a result. So there's the kind of data, the policy pieces. There's also efforts. I've met with the Living Donation Committee a few months back, I believe, and they really talked about their interest to support more living donation programs around the country and really helping share best practices for standardization and kind of supporting quality improvement across all of the programs. So there's some effort there. And then, I would say around the support piece, HRSA also supports, outside of the purview of the OPTN directly, but connected to it, the National Living Donation Assistance Program, which is actually a grant program that helps individuals defray the cost or any financial barriers associated with living donation. And so that's an important program to address one of the barriers kind of we've talked about, or areas of support people have discussed today. And then finally, we also have a program here in HRSA in our transplant arena focused on public outreach and education. And I will say I've seen more of a focus on living donation in the last few years. And this year, with our different celebrations of Donate Life Month and other observances, there was really a focus on lifting up living donation. And I think one of the kind of PSAs and educational endeavors really focused on the uniqueness of living donation and how important it is to really, I think, encourage more individuals to think about that opportunity.
Yeah. Thank you, Dr. Nick, for sharing those resources and those updates. I know that for our report, that relationship of someone being a living donor and a caregiver at the same time was really brought additional challenges and complexities. So appreciate that there's work in that area. So the next question also came in from pre-registration, and I'll address it to you, Lorinda or Melissa, but if anyone else wants to answer it as well, please signal. And that is, what is the best way to communicate with patients and caregivers about their role in transplant policy and real-time changes? So it's like, how do we communicate what's happening in the policy space on real time? So happy to hear from you, Lorinda or Melissa.
I'll go ahead and go first, I suppose, or unless Lorinda, you would like to go first. I'm good either way. Definitely education. We definitely need to start from the top down, having homogeneous communication amongst, from HRSA down to the centers, down to the patient. It's all got to be the same, and encouraging those families to get involved in public comment, like Lorinda was speaking to earlier, and many other opportunities. I look forward to seeing that in the future. Lorinda?
I would say that, it's really important that organizations out there are sharing, hey, public comments open. It's your time to make your voice heard, because nothing can change unless you put it out there. And I think that's really imperative for patients to be able and tell them, you don't have to be a doctor. You could just be a person, just putting the information in there. Put your, I think we try to make it very where you can watch a video and it can summarize things. And I think that's very important. But patients sometimes are a little scared because they're afraid they're going to sound wrong or something like that. And I think, taking that fear away would be very important. I think PSAs are a great opportunity to talk about this is what, because transplant, no one really talks about it
Yeah.
until it's time.
That is true. And I think for NAC, we are big supporters of creating those opportunities for people to take advocacy, to take action and create those advocacy opportunities. But I also am reminded of your remarks, Gina, and your program, and how you have a whole, GLI has a program dedicated to saying your story is really important. These are some ways that you can share it, and this is how to connect it to policy. So is there anything that you want to add to this question?
Was that to me or?
To Gina, I'm sorry. If
I'm sorry. And then I'll add on after
GLI.
Gina.
Yeah.
I'd like to add on.
The
Jean, please
GLI
feel free.
A3 group. Please tell us more.
Yeah, I just I think it's, yes, storytelling is very important. It's really how you normalize the process and how you reach people and how you find common ground. And so I encourage everyone to, explore how to tell your story and how to package it for different audiences, because it is a different version, or not necessarily a version, but different information might be more impactful for different audiences. So I encourage you to reach out to me for more information. I can hook you up with some of our wonderful patient ambassador storytellers who would love to mentor patients and caregivers in this process, and encourage you to look into the A3 Advanced Advocacy Academy. I will turn it over to Jean.
I was just going to follow up on the comments about commenting on some of the policies that come out.
Yeah.
And extremely important that is, because we are required to review all the comments and acknowledge them. And so when we put out a final rule, it really does address the comments that we receive. Now, I know not many people sit around and wait for us to put out 1,000-page rule so that they can read it. So organizations such as those that have spoken today are so important to getting the word out. Like I heard a couple of times today, oh, we commented on the IOTA rule, or we commented on that rule. And so you have kind of your ears and eyes open to let others know, because we really do want to hear diverse opinions. And so we can consider all of that before we make any kind of final decision. So it really is important. Thank you.
Yeah. Thank you for saying that, Jean. Yes, we actually have a sign-on letter that we're working on right now regarding the physician fee schedule and the caregiver training services that we'll be sharing with our partners in a few days, because I also believe that it's so important to ask questions and to propose and to comment, whether in favor or otherwise, about what is happening in the transplant care system. And in the other big project for us is around cancer care. So those are where our letters have come from. But going back to the topic at hand, the next question is for Gloria. And the question came from an attendee today, and it says, where does advanced care planning come into play, or discussions to help support family caregivers as well as the care team?
Thanks for the question. I think as a social worker, I believe that advanced care planning starts at the very beginning, even before you know about your end-stage kidney or liver disease. It really should start at primary care, because once you get to end-stage organ failure, oftentimes that may or may not be too late. For the kidney transplant population, when I see patients when they come in for their evaluation, I start having that conversation with them. We talk about medical power of attorney, we talk about advanced directives, and I give them the forms during their initial evaluation so that they can bring it home, review it with their family members, and start having that conversation. And oftentimes it's not a one-time conversation. It's multiple conversations that patients not only have with their family members, but also they come back and want to review it again with either my staff, myself, or the physicians to get a better understanding of the terminology, because that can also be confusing. But I think advanced care planning, just to give you a succinct answer, is it starts before organ failure. It really should be at primary care. And when patients and family members come in for evaluation, we really need to have that conversation from them.
Yeah, thank you for that, Gloria. This next question, I'm going to turn it over to, I believe it's you, Dr. Nair or Jean, and it's around the new independent OPTN board. And the question is, should the new OPTN board be composed of 51% donor families, transplant recipients, and those waiting, as well as those waiting and their caregivers?
Great. Thank you for that question. And I think that's one of the opportunities that we're really excited about that comes along with OPTN modernization. If you remember, governance was one of the key areas that we're looking at. And so there is an opportunity. We have now separated the OPTN board of directors from the OPTN contractor. And then one of our next steps is really working with a new board support contractor to help the board and the community consider what are some of the changes, if any, that we need to make to the size, the structure, the composition of the OPTN board. I know it was probably through a lot of deliberation and public and community engagement that they landed on the requirements that went into the final rule. And so we want to take a deliberative process also as we move forward and contemplate the various approaches one can take around the size and structure and composition, for that board, so that the board is maximizing its capacity to really support the system moving forward. So definitely something that would be important for patients, families, and caregivers to engage in as we go through that deliberation process.
For sure. Thank you for that. And this next question, this will be your last question. It came in from the live, and it is, how many, it says we invite caregivers to our patient support groups, but I'm wondering how many programs have a support group solely for caregivers? And so to me, this question, I interpret it as when we've been talking collectively about patients, families, and caregiver, and this question is, what types of programs and supports are specifically for the caregiver only? And if anyone, I'm thinking you, Gloria, but happy to open it up to anyone else who wants to take this on.
I can start first. I'll say we, at my current transplant center, we actually just started our program 2.5 years ago. So relatively new. And in our kidney transplant program, we're actually doing a needs assessment survey to our patients and caregivers, just to get a sense of what our patient and family population actually need. And within this needs assessment survey, we're asking, would a mentorship program or a support group be beneficial for you, or both, or neither? And would you prefer more education resources like videos or paper flyers or handouts? I think I personally do support groups and peer mentorship programs, but we really need to look at the populations that we serve within the region that we serve, because that can be different. And so I do know of a few transplant centers who offer caregiver support groups specifically for caregivers. And I know that there are a few panelists here who are from organizations that offer caregiver specific support groups. But depending on this population you serve, the needs may vary.
For sure. Yeah. We have about, anyone else wanna, I could keep us.
Well, TRIO has a peer-to-peer for the care partners, and that's been going on for about 2 years. And we actually have a dietitian that comes in and speaks to them, because we know it's important for them to stay healthy. And sometimes they need to just vent, because there is a lot to take on. And for them to have their own place that they can go on Zoom, no, because there's sometimes people can't get away from the house because they have to caregive and someone's sleeping. And I think having that opportunity to be able to call in and say, you know, I'm frustrated and I'm mad. And it's okay to say that and be in with other care partners or caregivers that go, you know what, we felt the same way before, and this is what happened, and this is how we solved it. I think that is immensely helpful for the mental health of caregivers.
For sure. And go ahead, Melissa. I did see your box light up.
Thank you so much. Appreciate Gloria and Lorinda's comments. And I want to say too that we also, Transplant Families has a moderated Caregiver Connect session with a social worker present at all times. But it's definitely a combination of meeting patients where they're at. And that's at the hospital. Sometimes I've received great support at the hospitals, but sometimes you just want to go online and chat with someone too. So whatever's comfortable for these caregivers, we just have to give them many options so that they can choose and be there and have that support.
For sure. And it brings me back, at least for me, to Cody's first initial remarks about wanting a shared space and needing a space where there was others that were going through the same thing, and how important that is for many reasons, for the support, for the logistical, what did you do? And then as a mental health space. So appreciate that. I hope that this, that'll be your last question. I hope that the information that was shared during the forum was informative, and you found, I certainly found all of the panelists' work inspiring and efforts. At NAC, we work tirelessly to make caregiving more dignified, more equitable, and sustainable. And so for the last, 7 minutes that we have together, I'd like to invite everyone to envision what that would look like in transplant care. And so to do that, we're going to create a live cloud. And so to participate, if you can answer, please answer this prompt in one word, what would be the most significant benefit of engaging and including family caregivers in transplant care? Oh. And I'll drop the prompt in the chat as well. And again, we want you to envision with us what it would be to include family caregivers. Oh, and I just mess up our word cloud because I included the prompt, but we'll fix that. Okay, so I see health. We would definitely be healthier in terms of both thinking holistically, not only the transplant recipient, but the caregiver. Definitely inclusion. Oh, I like this, enriched. So. Oh, that one's interesting. Diet. Okay. Comprehensive for sure. Empowered. Yes. All of these things. Okay. Oh, I see a few. Collaborative. That's right. Okay. So this is great. If we can, and support, of course, we've been talking so much about support. If we can turn it over to the slide around the or action, take action. We have a few actions that you can take to continue to support and advocate for family caregivers. The first one is, if you haven't yet, please read our report, Transplant Caregiving in the US, or share with other caregivers, advocates, and communities in transplant care. number 2 is we're gonna, please save the date for our next webinar, which is on October 24th from 2:30 to 4 p.m. We're actually really excited to let you all know that we surveyed transplant centers about their policies and practices around identifying, assessing, and providing support to family caregivers. And that's the day where we're going to be releasing the results. We're going to be releasing a report as well as sharing our results in this webinar on October 24th. And the best way to stay updated in what we're doing around transplant care is to sign up for our newsletter. You can receive specific updates about our transplant care. And if Lauren, you can drop or add that link to the chat, that would be great. And also check out many of the links in the programs that our panelists shared. There is a wealth of resources that was shared with you as well. And so I want to do a shout out for that. And in the last 3 minutes as we wind down, I would love to hear any takeaways from the presenters, the panelists, or any of the attendees. Feel free to add them to the chat. Again, we really wanted to have this forum and this space to talk about the role of caregivers within transplant reforms and really elevate and uplift how family caregivers are really champions in care in the transplant system. And so really appreciative of all of our speakers, our partners, GLI, our panelists, and of course our funders for making this possible, Sanofi and Takeda, and all of you for joining us. So I look forward to seeing some of your takeaways if you want to participate in that way. We weren't as active in the chat, but we will be reading those comments and taking those into consideration. So I see Gina, thank you for Gina's comment. Thank you to all the caregivers and NAC who make a difference in our lives. Thank you for all your work that you do. Trisha says, your efforts make a difference in the lives of caregivers and those they support, and your commitment to this cause is deeply appreciated. Thank you, Trisha, for spending your afternoon with us. And I think that is a great way to wrap up. Again, thank you. Thank you all to speakers, our panelists, and again, our funders, Sanofi and Takeda. Thanks, everyone.